pressure sores or bed sores? Pressure sores or bed sores are areas of damaged skin caused by staying in one position for too long. They commonly form where your bones are close to your skin, such as your ankles, back, elbows, heels, and hips. You are at risk if you're bedridden, use a wheelchair, or are unable to change your position. Who are vulnerable to pressure sores? Pressure sores develop primarily in elderly patients. 1/3 of patients who undergo surgery for hip fracture develop pressure sores. The longer the patient is bedridden, the greater the chances of developing a pressure sore. Symptoms. Warning signs of bed sores or pressure ulcers are unusual changes in skin color or texture, swelling, pus-like draining, an area of skin that feels cooler or warmer to the touch than other areas, tender areas. Causes. 3 primary contributing factors for pressure sores are 1. Pressure. Constant pressure on any part of your body can lessen the blood flow to tissues. Blood flow is essential for delivering oxygen and other nutrients to tissues. Without these essential nutrients, skin and nearby tissues are damaged and might eventually die. For people with limited mobility, this kind of pressure tends to happen in areas that aren't well padded with muscle or fat and that lie over a bone such as the spine, tailbone, shoulder blades, hips, heels, and elbows. Friction. Friction occurs when the skin rubs against clothing or bedding. It can make fragile skin more vulnerable to injury, especially if the skin is also moist. Shear. Shear occurs when two surfaces move in the opposite direction. For example, when a bed is elevated at the head, you can slide down in bed. As the tailbone moves down, the skin over the bone might stay in place, essentially pulling in the opposite direction. Risk factors. Age. Older adults tend to have thinner skin, making them more susceptible to damage from minor pressure. Lack of pain perception. Spinal cord injury and some other diseases cause a loss of sensation. Natural thinness or weight loss. Muscle atrophy and wasting are common in people living with paralysis. Malnutrition. Pressure sores develop if you have a poor diet, especially deficient in protein, zinc, and vitamin C. Urinary or fecal incontinence. Smoking. Other medical conditions such as diabetes and vascular disease. Decreased mental awareness. Immobility. This might be due to poor health, spinal cord injury, and other causes. Common site for pressure sore. For child who use wheelchairs, Pressure sores often occur on skin over the following sites: tailbone or buttocks, shoulder blades and spine, knee, backs of arms and legs where they rest against the chair. For people who need to stay in bed, pressure sores may occur on the back or sides of the head, shoulder blades, the hip, lower back or tailbone, the heels, ankles and skin behind the knees. In supine position or lying on back, pressure sore may occur on back of head and ears, shoulder, elbow, lower back and buttock, hip, knee back, heel and toe. In prone position or lying on stomach, pressure sore may occur on head, elbow, chin, chest, reproductive organ, front knee and toe. In side-lying position, pressure sore may occur on ear, shoulder, elbow outer side, hip, knee, both outer and inner side, ankle and heel. In sitting position, pressure may occur on back of head, shoulder, base of spine, buttock, heel, toe. Stage or level of pressure sores. Pressure sores fall into one of several stages based on their depth, severity and other characteristics. Stage 1. Most superficial. Non-bleachable redness does not subside after pressure is relieved. The skin may be hotter or cooler than normal, have an odd texture, perhaps is painful to the patients. Stage 2. Damage to the epidermis extending into but no deeper than the dermis. In this stage, the ulcer may be referred to as a blister or abrasion. Stage 3. Involves the full thickness of the skin and may extend into the subcutaneous tissue layer. This layer has a relatively poor blood supply and can be difficult to heal. Stage 4 is the deepest, extending into the muscle, tendon or even bone. Depth varies according to anatomic location. Treatment objective: identification of problem, debridement of necrotic tissue, moist wound care without maceration, control of infection, management of pain, pressure redistribution. Treatment: conservative treatment. Although it may take some time, most stage 1 and 2 sores will heal within a week with conservative measures. But stage 3 and 4 wounds, which are less likely to resolve on their own, may require surgery. It includes changing position often, using support surfaces, cleaning, controlling incontinence, removal of damaged tissue or debridement, dressing, oral antibiotics, healthy diet, educating the caregiver. Pressure redistribution using waterbed, gel bed, air bed. Surgery repair by tissue flap, free flap, negative pressure, wound therapy. Other treatment options. Researchers are searching for more effective bed sore treatment. Under investigation are hyperbaric oxygen, electrotherapy. Time period. Time period. Bed sores can develop over hours or days. Most sores heal with treatment, but some never heal completely. You can take steps to help prevent bed sores and help them heal. Tips for repositioning. Consider the following recommendations leading to repositioning in a bed or chair. Shift your weight frequently. Ask for help with repositioning about once an hour. Lift yourself if possible. If you have enough upper body strength, do wheelchair push-ups, raising your body off the seat by pushing on the arms of the chair. Look into a specialty wheelchair. Some wheelchairs allow you to tilt them, which can relieve pressure. Select cushions or a mattress that relieves pressure. Use cushions or a special mattress to relieve pressure and help ensure that your body is well positioned. Do not use donut cushions as they can focus pressure on surrounding issue. Adjust the elevation of your bed. If your bed can be elevated at the head, raise it to no more than 30 degrees. This helps prevent shearing. Tips for skin care. Consider the following suggestions for skin care. Keep skin clean and dry. Wash the skin with a gentle cleanser and pat dry. Do this cleansing routine regularly to limit the skin's exposure to moisture, urine and stool. Protect the skin. Use moisture barrier creams to protect the skin from urine and stool. Change bedding and clothing frequently if needed. Watch for buttons on the clothing and wrinkles in the bedding that irritate the skin. Inspect the skin daily. Look closely at your skin daily for warning signs of a pressure sore. Disclaimer. This information is provided as an educational service and is not intended to serve as medical advice. Anyone seeking specific medical advice or assistance should consult his or her doctor or therapist.